Good morning. Welcome to the Public Health Just the Facts radio program. My name is Elisa Howard, and our show is sponsored by the Southern Nevada Health District. As we talk about the Health District today, we do have one of the Health District employees on today. I'm really happy to have you here, Dr. Loaf. It's really exciting to meet you. I know you are from the vaccination department, correct?
Yeah, part of my area is to work on vaccine issues, but I also work on a number of other issues as well.
And what are those other issues?
Yeah, so I'm really heavily working with our folks on COVID vaccination right now. I also support our immunization program, which includes our childhood vaccinations, which we're going to be talking about today, our TB program. I help support our public health clinics as well, including our sexual health clinic. And then I do a variety of other kinds of things. One of the things we're kind of dealing with right now is a monkeypox outbreak, so I'm helping to support that too.
I want to talk to you about all of that. I'm so
Sounds
interested in it all.
All right.
So as we get into the show, I just want to introduce our topic. Today we're talking about childhood immunizations, but as Dr. Loaf said, there's so many other things that he does that why not take advantage of him being here today and listen to what he has to say regarding COVID, because people think that COVID is gone, right? Are you working with the COVID department over there?
Yeah, we are. So the health district continues to be very involved with COVID, both in terms of making sure that testing is available, that vaccinations are available. And then in the last several months, we also have treatment options available for folks who come down with COVID, who might be at risk for more severe disease and hospitalization. So we're trying to make those drugs available to those folks as well.
And that's the thing that I don't think personally a lot of the people in the community know about is the actual, when you say drugs available for COVID. What does that mean and what does that look like?
Yeah, so there's a variety of treatment options available for folks with COVID. So there's antiviral medications for those who test positive for COVID and who may be at risk for more severe complications or hospitalization. So folks, anybody who's like older than 50 or anybody younger than 50 who might have one or more chronic health conditions, both those kinds of risk factors predispose them for more severe infection with COVID and might end up in the hospital or die from that. So we have a couple options available for antiviral medications. There's also what's called monoclonal antibody infusions that are available. The health district doesn't provide those per se, but there are some clinics in the area that provide that. And those too can be used for treatment of folks with COVID. And then we also have what's called essentially pre-exposure prophylaxis. So folks who might be at really high risk for complications, hospitalizations, or death. For example, folks that might have had a recent transplant or have cancer or on a very aggressive immunotherapy drugs. There's pre-exposure prophylaxis that can be given to them to really prevent them from coming down with COVID. So lots of options available now that we hadn't had available this time last year.
Now, I know pre-exposure prophylaxis is also used in sexual health.
Yes, correct.
So I still am a sexual health educator,
Great.
STDs and HIV. And so we talk about PrEP and PEP often. So we wouldn't expect to hear it on the COVID side. But I'm glad that you mentioned that, because a lot of people, from what I'm still going into the community educating on COVID, they're like, there's no cure for this. But there's vaccines, right?
Yes.
And so as we talk about vaccinations, how important is it to still get your vaccines for COVID?
Yeah, it's very important. So, there's a lot of evidence. The CDC has done a really great job really doing the research and providing the evidence basis for the COVID vaccination. So basically, the vaccines really are very effective in preventing infection, but most importantly, really effective in preventing severe disease, hospitalization, and death. Even in vaccination is really even important for those who might have had a recent or a past exposure or infection with COVID. So even if you've had COVID in the past, like I have, people are still encouraged to get their vaccine and booster dose if they're eligible for it.
Thank you. And one thing that I am hearing is that I've had COVID before. I have antibodies. How long do those antibodies last?
Yeah, another very aggressive area of research. Generally, it's thought that it's fairly unlikely that you're going to get reinfected within 90 days after your infection. So you're pretty good for up to 90 days. But after that point, the evidence is suggesting that your immunity from that prior infection is waning, and you're no longer adequately protected, which is why, again, that we want to encourage people to get vaccinated, again, even if they've had a prior infection with COVID.
Thank you. That's really important, I think, to emphasize because we're in Las Vegas, right? And Las Vegas is a city that does not sleep. So we quickly got back open, and a lot of people think that because things are open, that there's still not COVID happening. One of our guests was supposed to be on today, and, being around family and 4th of July and things like that, sometimes we're still being around people who are exposed to COVID. And we have to keep that in mind, especially during holidays, and a lot of holidays are coming up. So I really want people to know and understand that you still probably should be taking a home test, right? Even if you can't get down to the health district, you still should be taking a home test if you're around a big crowd of people. You went to a concert, you went around family.
Yep.
Do you agree?
Absolutely. I think there is this perception that it's because it's not in the news as much as it used to be, and because we're not all walking around with masks and having all these restrictions, that COVID has gone away. That's absolutely incorrect. There is still lots of COVID here in Las Vegas, around the country and the world. In fact, our data suggests that around 30% of folks who test for COVID are positive for COVID. So it's here. It's going to continue to be here. And the best we can do is make sure that we get ourselves and our family members vaccinated and keep up with our booster doses. And most importantly, I think if we're going to be around folks who are elderly, folks who are immunocompromised, make sure that we do take some extra precautions around them to prevent transmission to them, because they're the most vulnerable to severe disease, hospitalization, and death. So we want to do whatever we can to protect them. So making sure you wash your hands, making sure you adequately social distance, wearing a mask around them, those kinds of things can be very effective in preventing transmission to our most vulnerable populations.
I was actually thinking about that this morning, actually, because I was just thinking about family and how we all are trying to get back together, but still being cautious, right? Because there's this thing where we want to go see our aunts and our uncles that are older. Of course, we want to look after them and take care of them, but we also want to make sure that we're doing it while we're healthy.
Exactly.
And making sure that we're testing and having that consciousness just about, hey, I've been around a lot of people. I've been around my friends. I've been hanging out. I went out to the club, whatever it was. And just knowing that if I go around my aunt or my uncle or my parents that are elderly, that I should be more cautious about going around them or going and seeing about them, but still have a mask on.
Absolutely. So certainly if you're sick with any symptoms of a upper respiratory illness, fever, cough, sore throat, things like that, just stay home. Stay home from work, stay home from school, stay home from visiting those folks that you spoke about. If you're unsure about your status, if you feel kind of run down, take a home test or come to one of our many locations in the community to get tested. And certainly if you're really, really sick, then go to the local emergency department to get checked out.
And now you said many locations. Can you tell the community where those locations are particularly? You may not know, but I think a lot of people think that the clinics have shut down now for COVID. Is that correct, or are they still open?
Yeah, so the health district continues to operate several testing sites around the community. We have a couple locations at CSN locations. Our health district site at 280 South Decatur, we also offer testing Monday through Friday between 6 a.m. and 2 p.m. And we have our website, snhd.org, has a listing of all current testing locations, as it does all the vaccination locations.
Perfect. That's exactly what I wanted you to say. I wanted you to give those resources of where they can find that information at. I think it's really important to stay talking about this. Obviously, our Arm in Arm campaign, which you see behind us, is all about COVID. It's working with the Southern Nevada Health District, but it's about community and literally working arm in arm with each other, holding each other accountable for COVID, but also just to be healthy and just to make sure that if I come around you, that you've done your due diligence and making sure that you're healthy as much as you can, right?
Exactly.
And so it's about just working together. And I think that's what the main part of COVID I would like to just press in and kind of hold on to, is that it's all about community and really we all affect each other.
Yeah.
And it's definitely an intersection between communities, right?
It is. And I think, looking back the last couple of years, that's been one of the most inspiring and also the most disappointing things, is this sense of community or lack of sense of community, because we obviously saw a lot of people come together to do what they needed to do to really try to protect themselves, their family, and the community for COVID. But then again, on the flip side, we also saw others that were very resistant to these kinds of measures, and we still have people resistant to vaccination. And I would just like to say to them that we really need to all, to your point, really need to continue to come together to address this epidemic and continue to collectively do the things that we need to do to protect ourselves and others in our community. And that includes getting vaccinated. So really cannot stress that point enough.
Thank you for that. So we'll move on from COVID. Since you do so many other things, I want to make sure we have enough time to talk about these things. So as we're coming up on the school year, we're having a very difficult time. The school district here is having a very difficult time finding teachers just because of everything that's going on, COVID and, just a lot of things that are happening within the world, but also just in the city. How important is it for parents to know about their kids getting vaccinated, not just for COVID, but also for all the other childhood diseases?
Yeah, certainly. So I will say this, there is a COVID vaccine available for kids now as young as 6 months of age. But that is not a required vaccination for kids to go to school or daycare center. So I just want to put that out there. But on the other hand, there are other vaccines that are required for children to get before they go to preschool, child care centers, or kindergarten. There's a whole list of things, vaccines against hepatitis A and B, against measles, mumps, and rubella, against chickenpox, and diphtheria, tetanus, and pertussis. So those are kinds of the diseases that vaccines are required for both child care and for kindergarten entry. And then kids who are entering the 7th grade and 12th grade, they're also required, for kids entering the 7th grade, they're required to have a vaccine against meningitis, as well as a booster dose for the diphtheria, tetanus, and pertussis. And then 12th graders are required to get a second dose of the vaccine against meningitis as well.
Now those same vaccines are required when you go off to college, correct?
Correct.
Okay. And so that's really important for those students that are now going off to colleges as well, to know that, for the parents to know that they have to be vaccinated. Some colleges won't let you in without that vaccination card, correct?
Yeah, and meningitis is a particularly important one. It's still very uncommon, but there have been cases and outbreaks among college campuses and also in military situations, mostly because there's lots of people that come together in very close settings, and that the transmission of the bacteria that causes meningitis can easily happen. So you hear really kind of horror stories about kids coming down with meningitis and dying as a result of that. Previously healthy kids come down with this that may die or have very severe disease where they might have to have their arm or leg amputated because of that. So
what is meningitis? Can you tell us that?
So meningitis is basically an infection of the lining of the meninges, which is the lining of your spinal cord, and generally can be due to bacteria or also to viruses, but the ones that we're mostly concerned about are the bacterial infections. And in some cases it can be very severe, and in fact people can die from this as well. So we want to make sure that we do our best to make sure that parents are aware of the availability of these vaccines and make sure that their kids get vaccinated against it.
And before I lose my thought on this, as you're talking about all of the required vaccinations, it just makes me think of all that we went through with COVID, right? And people just not wanting to get vaccinated, and you can't make me, and all of these things. And there's been required vaccinations for almost 100 years.
Yeah.
With having to go to school and being around other people. So it kind of just makes me think in the same breath. That's how COVID is. Yeah. COVID is one of those things that it's a virus that has come plagued our country, our world. And we're just trying to vaccinate people against it, just like we have in the past with everything else, right? Measles and mumps, things that we don't see anymore. They've been eradicated because of vaccinations. How important are vaccinations to our world?
Very important. Without vaccines, we would continue to have large outbreaks of all these diseases because these diseases are still around. The only disease that we've been able to eradicate through vaccination is smallpox. But all the other vaccine preventable diseases, if you will, are still present. And absence of widespread vaccination in the United States or around the world, we're going to continue to have these cases and outbreaks. Even in the U.S., in the last decade, we've had outbreaks of vaccine-preventable diseases that we hadn't had in decades. Measles, for example, mumps, things like that. So, again, just really brings home the fact that we really need to make sure that people are aware of the vaccinations that are available and make sure that they have access to these vaccines and get vaccinated.
And we know in underserved countries around the world that they don't have access to a lot of these vaccinations a lot of times, right?
Mm-hmm.
Or whether it's, social determinants of health that keep them from getting vaccinated. So maybe it's there in their country, but maybe they don't have transportation to get there. Or maybe there's not a local doctor. A lot of people still live in remote areas. I like to think that, we are very privileged here in the United States. And the fact that we have these vaccinations down the street from us, that's how important it is just to go and get these vaccinations, right, for your children so that they
Absolutely.
can stay safe and we can keep our generation safe.
Absolutely. Fortunately, worldwide, there are great programs in place to be able to provide access to all these vaccines to all populations, regardless of which country they live in or how hard it might be able to access them. And I think that's been the strength of the really a hallmark of the smallpox vaccination campaign, is that they've been able to really go to the even remotest areas of the world to provide vaccine. And that's how we've been able to eradicate those diseases. So next in line is polio, which is another vaccine preventable disease. It's still out there, but it's out there in very small numbers and very small regions of the world. So I think the next hope is to be able to make sure that we try to eradicate that disease as well. And we're doing that through lots of resources and staffing and programs to try to understand where the polio virus is still causing infection and make sure that resources are provided to those communities to vaccinate those populations.
Wow, I'm learning so much from you. I did not know that there were still populations that suffered from polio. I thought that was a totally eradicated disease.
Not yet, but hopefully soon.
Wow, that's really interesting. I used to know a lawyer that I worked for as a paralegal, that had polio, and he got it as a child. At that time, he was 58, and he was basically crippled, but still made it to be a lawyer, made it to be a judge, and all those things. So people still, live with these things. But, I just remember that being so prevalent because at 25, I had never met anyone that suffered from polio, because at 25, my mind at that age was, oh, that's gone, you know?
Right, exactly.
Now being in public health, we know that things are not completely eradicated, and that we still have to get vaccinated, still be aware and kind of conscious of what's going on throughout the country.
Absolutely. And polio is one of those successes here in the United States in terms of our ability to develop novel vaccines against that particular virus and vaccinate large numbers of people in a population in a very quick period of time. And that's why we don't see these large outbreaks of polio anymore like we've seen in the 50s and whatnot. So, and on the opposite side, if people don't see these diseases, so they feel like, oh, they're gone, they're not going to impact me, so why do I need to get myself or my kid vaccinated?
Exactly.
So it's kind of a catch-22, if you will. But again, the bottom line is these diseases are still out there. Absent widespread vaccination, they're going to reappear. And to the extent that we've seen them, and likely reappear to the extent that we've seen them in the past, again, absent widespread vaccination.
Thank you. And before we move on to the newest, the latest monkeypox, I wanted to ask you quickly, explain to the community maybe what a pandemic and an endemic is, because it sounds like a lot of these viruses and diseases that have come about, although we don't hear about them as much, they have gone into an endemic stage, but people may not know what that is. Can you explain that?
Yeah, so essentially a pandemic is a worldwide epidemic, and we see that with influenza, and we've seen that most recently with COVID, meaning that it's a virus that spread all over the world. And it's in that case, it was a new virus that because it was new, because it was novel, was able to, everybody was susceptible to it. So that's essentially a pandemic. An epidemic is excuse me, is more of a localized sort of outbreak of some disease, be it like COVID or some other infectious disease. And then to your point, when something is endemic, meaning that it's just here, sort of, but at more background levels, it doesn't cause like widespread outbreaks and things like that. It's just present, but we still have to deal with it.
Right. Right. I have a lot of questions, when we say these words, because we're in public health. We're used to using these words around each other, but trying to get to just the facts and help the community understand these words is sometimes challenging because you have to break down these, because we just talk, we're just talking endemics, pandemics, and the community might be like, what are they even talking about? This sounds foreign to me. So I just wanted to take that time to break down what a pandemic is, and if they hear the word endemic, what that actually looks like. And then you said a couple times actually novel virus. Can you explain what that is?
Well, I think COVID is a classic example of a novel virus, meaning that it's a virus that just emerged and wasn't present in our population prior to that. And with COVID, the thought is that it might have had a reservoir, meaning it was present in like some sort of like animal or mammal, and somehow was able to mutate just enough to be able to cross over from that animal to a person. And then once it was in a person, it was able to replicate and then spread to other people. So that's how some of these viruses have been emerging. The HIV virus is another example of a virus that was previously found in certain kinds of animals that somehow was able to mutate just enough to be able to spread to people. And then once it got into people, it was able to spread from person to person. So that's what we're really up against with some of these diseases, is that we really have to be on the lookout for these novel viruses and novel diseases, because those kinds of things can really tremendously impact the health of our populations.
Right. And you segued right into it with HIV and being found in certain animals. Monkeypox was found the same exact way, right?
Yeah, there's some misnomer. I think monkeys are being blamed for this outbreak. Poor things, but but they identified it initially in monkeys, so it's hence the name. But it is becoming a very serious problem in the United States and around much of the developed world. There's been, as folks know, there's been lots of cases in the United States and in other developed countries as well. We've had now, I think, 4 probable or confirmed cases among residents in Southern Nevada. Fortunately, there's lots of tools in our toolkit to be able to deal with this disease. We have good diagnostics to be able to identify folks with symptoms and get them tested. We have good public health measures to make sure that once we do identify folks who are or do have monkeypox, that we can put them in isolation, give them vaccine, and we can also identify their close contacts to get them put them in quarantine, so as they can to try to prevent further spread of this as well. And education is very important as well. And
getting in contact with their contacts, people they've been in contact with, is called contact tracing, correct?
That's correct.
And how important is contact tracing?
Yeah, it's very important. I mean, we saw that being very important with our COVID, because that's one way that we can really try to work to try to halt the further spread of this virus. Unfortunately, with COVID, we did recognize that it was very resource intensive. So for every one person that tested positive for COVID, they might have had, dozens of close contacts. So it's very resource intensive to be able to not only identify all those folks, but also reach out to them and make sure that they're doing what they need to do to prevent themselves from becoming infected or from spreading it to other people. So it's very resource intensive. With monkeypox, it's not as much of a challenge right now because we have so few cases, but it's always difficult though to, especially with monkeypox, to be able to identify all the close contacts of these cases. So that's been one of the challenges so far with this.
And then you mentioned just monkeypox and HIV and all of these things that we vaccinated currently against. I was thinking of research and how important it is for people to get involved in research, because I work with a lot of researchers, and that's one of the challenges that they have at UNLV and UNR, but just throughout the country as well. I have a lot of research friends that are in public health, and getting certain populations of people to be involved in research has always been a challenge. And I would just like you to explain, without me explaining it, but you explain how important is it for us to have research in public health from different populations of people and different genders and things of that nature?
Yeah, it's very important. So we want to sort of, in our research efforts, we want to really try to reflect the diversity that's in our population, because without that, then we really don't have a true understanding of the effectiveness of some of the things that we're trying to do. So I think historically, a lot of the research efforts was tied to kind of specific populations. In some cases, they excluded certain minority groups or women or what have you. Now there's really been a change, and in fact, a push to try to be more inclusive when we do these kinds of public health research efforts. And there's been a lot of community-based participatory research where they're actually going into the communities now, enrolling folks within impacted communities to try to get them involved within research efforts as well.
Right. Now we can go on about why certain populations don't want to be involved in research because of the historical medical research that was done on people and things of that nature. But I won't get into that because that'll lead us down a whole nother path. But I do want to go back to monkeypox really quickly. How likely is it for someone in Las Vegas, Nevada, to contact or contract monkeypox? Is there anything that people can do to, stay away from it, or what should they be looking out for?
Well, unlike COVID, which is actually fairly easily transmissible, monkeypox is not. So that's a good thing. So monkeypox is generally only transmitted through really direct, close personal contact. There's been evidence to show that there's been transmission of monkeypox among sexual networks, among the MSM population, or men who have sex with men. So that's been one of the predominant risk factors so far with the monkeypox.
We want to dispel that myth, right, about that this is just an LGBTQ virus that's going around, the LGBTQ, because it's happening just like HIV.
Yeah. Yeah, it's not just a disease that's affecting the LGBTQ community. It's a disease that can infect anybody, much like HIV, and to your point, it's a correct point. I mean, even though there may be our community might be at higher risk for some of these diseases. Doesn't mean that it's exclusive only to these communities. So that's a really good point to make.
And that's I really like to tone down stigma. Working in HIV for years, there's just so much stigma around HIV, and those people gave it to us. I don't like to hear those type of words, so I just wanted to dispel that now.
Good point.
That monkeypox is not just a LGBTQ plus disease or virus. It's affecting everyone. And right now in the country, I believe we have about, I just read something, 436 cases.
I believe so,
right?
yes.
Okay.
Yeah.
So it's not one, it has definitely spread since we first heard about it, right?
Yes.
But it's not in the thousands or hundreds of thousands yet.
Yeah. So again, the good thing about monkeypox is not readily transmissible, certainly not as readily transmissible as COVID or lots of other diseases. Mostly contracted through very close, direct physical kinds of contact, or sharing of clothes or linens or things like that might have been exposed to someone who's had monkeypox. So it's a really good thing. Yeah. And again, we have great testing available. We have now some vaccines that are beginning to be available for folks, both for prevention as well as for post-exposure prophylaxis.
Well, thank you. You've been a wealth of information about vaccines today. I'm definitely going to call you when I have some questions and send people your way. As far as, let's wrap this up with children's vaccinations again. Yes. Where can parents go to take their children to get these vaccinations to enter school?
Yeah, so essentially two places. So a lot of parents may just want to go to their child's pediatrician or healthcare provider to get the vaccine, which is great. Most pediatricians' offices, family practice offices have these vaccines available to them. So probably the best spot for a lot of parents. And then the health district also has 4 immunization clinics around Southern Nevada. Our largest one at 280 South Decatur. We offer all vaccines for children, adults, and travel vaccines. And we're beginning to gear up for the back to school season. So we're expanding our hours at our clinics. And we also made registration available online, or you can also call our phone numbers to register for an appointment. And we also accept walk-ins at our 280 South Decatur location as well.
Perfect. Thank you so much
You're
for
very
that
welcome.
information, for being a resource for our community. We really appreciate you being here. And that's a wrap. That's just the facts of public health. We're talking to Dr. Loaf again from the Southern Nevada Health District. Everything that you've heard here, you can go on to the Southern Nevada Health District website, find Dr. Loaf's information and these resources and where to find vaccination clinics. I appreciate you being here again.
You're very welcome. I'm glad to do it.
Thank you. Have a great day, everyone.